we emphasize people are not just numbers that we put into a spreadsheet or statistics that we publish in our research papers, but they're people. So when we collect data, it isn't easy to collect data from people who have experienced such a transformative experience in their lives. But the Breast Cancer Family Registry is making important strides in advancing how we define how lifestyle factors can make a significant impact on our breast cancer risk and genetic relationships for years to come.
It's probably one of the longest studies that I know of that is family-based around breast cancer, and it's important to be able to track people's lifestyles, whether they're healthy or maybe they've had breast cancer in their family or their own diagnosis in the past. Being able to understand the different life events that people have gone to or the different environmental exposures that they've experienced throughout their lifestyle is very important.
We have this amazing cohort of thousands of families who have been actively participating and contributing to our knowledge for years and generations, and no matter your risk, you're still part of the study, even if it's not even your immediate family member, even if it's your great grandmother. And that's what I find so amazing and unique, is that this selfless act and commitment of just contributing to science, to knowledge, and being able to contribute to this 27-year legacy is what's so amazing about the BCFR.
Participation is really important just because, we are seeing trends that show that incidence of breast cancer in young women is actually increasing, and understanding inheritance patterns and how cancer moves through families is going to be really important in just, bringing more risk factors to light. And that is going to help us create or help researchers to develop just better prevention strategies and interventions that are going to help families to come.
And especially when we're thinking of disparities in neighborhoods, which communities are more burdened by environmental exposures, poor health outcome, poor health care access.
I think what's so beautiful about the BCFR is that participants' feedback, comments, and getting to have that conversation with them is just as important as the work we do in our labs. So I think that's what really inspires me to keep finding answers, is hearing stories firsthand, hearing comments firsthand, and speaking to participants on the phone and hearing how much this 27-year legacy has really made a difference into their lives.
It's unique because it is taking a preventative approach to how we look at our breast cancer risk. And it is important because it's actually taking an approach where we're changing the mindset of families who have wide-ranging networks, as opposed to taking an individualistic approach to getting more people involved in breast cancer research.
I think just the long-term aspect of it really makes the registry unique.